Nicole. I am a nurse. I will be doing a pediatric assessment. This is Bella and her mother. Bella and Mom, do you consent on having this video uploaded and using your daughter as a student for this?
Yes.
Okay. Next, we're going to go ahead and scan the room, just make sure that there's no extra help or anything like that. After that, I'm going to go ahead and scan my note card in. That's only 10% of the rubric, and there's nothing on the back. Okay? First off, I'm going to go ahead and introduce myself. Hi, Mom and Bella. My name's Nicole. I'm a nurse. I'm going to be doing an assessment on your daughter from head to toe. Okay? I'm going to first wash my hands, actual soap. Okay. And then we're going to just put on the proper PPE. Make sure the room is comfortable for the patient and Mom. If it was a baby, the baby would be sitting on Mom's lap, making it a comfortable position. Make sure that the patient is appropriately dressed. We're going to go ahead and start with vital signs. So blood pressure was 110/64, pulse of 85 and regular, respiration 16, 100% on room air, and temp of 36.3. We had a height of 5 feet and 0 inches and a weight of 110, which is a BMI of 21.5, which is in the normal range. We would take those findings and compare them to Bella's previous visits and make sure on the growth and height scale that she is in proper standing. Next, we're going to go ahead and start off with the assessment. I'm going to inspect and palpate Bella's head. So we're going to go ahead and feel for any pain, tenderness, look at the hair, distribution of it, see if it's coarse, dry, anything like that. We're noting her general appearance, seeing if she's any in distress or anything like that, if she's having any pain, trouble breathing, just all of her reactions during the whole assessment as well. Next, we're going to go ahead and test your cranial nerves, 5 and 7. I'm going to have you go ahead and I'm going to have you close your eyes really tight. And then you're going to go ahead and stick your tongue out and raise your eyebrows. Good. Okay, next we're going to go ahead and we are going to move to the eyes. So we can start off and do the Snellen chart. Patient will stand about 10 feet away from the chart with both eyes. So OD, which is the right, OS is the left, and OU is both eyes. Bella did the Snellen chart beforehand, and we are 20/20 on each side, so she has perfect vision at this time. Patient can do it with corrective lenses or just regularly. Here, we're going to go ahead and use our otoscope and also our pen light. Make sure that they are properly working and cleaned. For this, we're going to go ahead, I'm going to assess Bella's pupil size and compare on the pen light here, and they are normal. We're also going to test the pupil reflexes, so you're going to watch the other eye that you're not shining light into, making sure that only the pupil that the light's shining in is constricting. You want to make sure that the pearl reacting to light, good. We're going to also notice the skin, notice internal and external canthus of the eye. We're going to just look and make sure that there's even hair distribution on the eyebrows. I'm going to have you look down, Bella. I'm going to pull up your eyelid. Good. Look up for me. We're noting the sclera, the pupils, and looking for any reaction there. Notice any redness, swelling. Next, we're going to go ahead and we are going to use the ophthalmoscope. I'm going to go ahead and turn off the light. We're going to look for optic disc and nerves and arteries and veins. Bella, look forward for me, please. Good. And this is the red light reflex. Good. Okay. Now we're turning the lights on. And we're going to test Bella's reflexes. So Bella, I'm going to have you actually start with your periphery. I'm going to let you know and let me know when you can see my fingers, okay? Good. Still look forward. Good. I'm going to have you go ahead and look at my pen. It's going to come towards your nose and come towards me. We're just looking for her crossing her eyes and coming back, looking for any nystagmus here. I'm going to have you go ahead and follow my pen again, and I'm going to go at different angles. So here we watch the eyes tracing and tracking, going in the 6th position. Good. After that, we're going to go ahead, and that was testing for cranial nerve 2, 3, 4, and 6. We're going to go ahead and move to the ears. So we're going to use our otoscope here, making sure that it's working and clean properly. We're inspecting the ears, making sure there's no pain, tenderness, no masses palpated here or on each side. We're looking, I'm going to look inside of her ear. I'm going to notice the tympanic membrane, make sure there's no fluid or wax, which there's not. Her tympanic membrane is gray pink, and it is translucent, so that is what we want. And for a child of Bella's age, we want to make sure that we pull up and away in the ear to look. Perfect. And we're going to go ahead and we're going to do cranial nerve 8. So I'm going to whisper something in your ear. Let me know what you hear. Good. Okay. So here we're going to move on to the nose. So we can use the otoscope again. We can palpate and inspect the sinuses. So we're going to go ahead and start with the frontal sinuses over the brow, maxillary, and the ethmoid. Any pain? No? Okay. Notice the symmetry of her nose too and her eyes in relation. Everything is symmetrical on Bella's face. Here we're going to assess her nose, and I'm going to look inside Bella. Notice the hair. We're going to look on each side in the mirrors. Make sure that there's no septal deviation, any polyps, any moisture in the nose. I'm also going to test for your air. So I'm going to have you go ahead and touch one finger to your nose and blow lightly. Good. Other side. Good. Okay, after that we're going to go ahead and move to the mouth and the throat. So here we can also use the otoscope as well. Make sure we have a light and a tongue depressor. Bella, I'm going to ask if you can go ahead and open up your mouth really wide. Say ah. Good. I'm going to assess here the size of the tonsils, which is +1. They are not touching each other, so it is normal. No inflammation, no exudate on the tonsils, the uvula is midline. We're noticing tongue, the color, moisture. Here I'm going to have you go ahead and open up your mouth again. We're going to assess her teeth, make sure there's no caries, see what there's any molars. Bella does have braces. I'm going to assess your gums here. Notice for any hypertrophy. Here also we can assess for gag reflex for the mouth. And then that all tests for cranial 9, 10, and 12. And to continue on with the cranial nerves, Bella, can you please stick out your tongue for me? Go inside to side. Good. And I'm going to go ahead and puff your cheeks. Good. And then touch the tongue to each side cheek. Good. Okay. After that, we're going to go ahead and move down to the neck. So I'm just going to palpate the neck. We're going to feel for the thyroid here. Go ahead and swallow for me. Good. So you want to make sure that you can feel that. Note the size of the thyroid, test for any goiters. Next, we're going to move on to the lymph nodes. So we're going to inspect and palpate. Notice the size on Bella. So we're going to do pre-auricle, post-auricle. We're going to do submandibular, submental. We can do occipital. We're going to do supraclavicular. The chest. We're going to do axillary. Under here, under each arm. Good. And then for now, we're going to defer. We're going to do the lymph node in the groin. We're going to defer that test at this time. Next, we're going to go ahead and do cranial nerve 11. Bella, can you just shrug your shoulders for me? Good. Can you go ahead and show me the motion of your neck and move up and down, side to side? Good. Next, we're going to go ahead and do the thorax. So I'm going to grab my stethoscope, and we're going to inspect and palpate each side separately. Listen for bruise with the bowel of the stethoscope. Go ahead and look on that side, Bella. And look towards me. And no bruises are noted here. Next, we're going to go ahead and do the chest and lung and heart assessment. Bella, if you could face your mom and turn a little bit. We're going to go ahead and inspect and palpate I'm going to move your hair. We're going to inspect and palpate the back. Notice any air trapping, pain, tenderness here. Bella, if you can take a deep breath for me. Good. We're also going to palpate for tactile fremitus. So Bella, every time I move my hands, you're going to go ahead and say 99, and we're going to do just the ulnar surface of our hands. 99, 99, 99, 99. Good. Next, we're going to go ahead and palpate or percuss over lung fields, and we're going to make sure that we don't hear any hyperresonant sounds comparing sides bilaterally. Next, we're going to go ahead and auscultate. So we're going to go ahead and start at the apex of the lungs, which is above the clavicle. Compare each breath sound, making sure there's no bronchi wheezing, any crackles, and there's none noted here. Okay, Bella, if you can come towards me. We're going to go ahead and inspect the chest. So same thing, I'm going to just go, you can go ahead and face forward. We're going to go ahead and inspect and palpate, notice any crepitus, pain, tenderness, swelling under each side, okay? We're also going to do the tactile fremitus again with the ulnar surfaces. I'm going to go ahead and move my hands, you just say 99. 99. Good. Next, I'm going to go ahead and auscultate again for lung sounds, compare bilaterally, starting at the apex, moving side to side. listening for any adventitious breath sounds. Okay, after that we're going to go ahead and do the cardiac assessment. So we're going to go ahead and make sure there's no heave, lifts, or thrills. And we're also going to palpate for the point of maximum impulse. So we're going to go left side, the fifth intercostal. Sorry, Bella. Okay, and this is the point of maximum impulse. Next, we're going to go ahead and listen with our bell and diaphragm for the cardiac assessment. We're going to do the diaphragm. So we're going to do the aortic, the pulmonic, Erb's point, tricuspid, and mitral. Again, I'm going to flip it and do the bell. So we're going to do aortic, pulmonic, Erb's point, tricuspid, and mitral. And here we're noting S1, S2 sounds, no murmurs, squishing, any adventitious heart sounds, in which we would document where they're located in each area. And there are no precordial bulging. She's not having any labored breathing at this time. She's not using accessory muscles, no nasal flaring at this time. She's not in any respiratory distress. So after the cardiac, we're going to go ahead and do the abdominal assessment. So Bella, can you please lay down for me? Okay, so here we're going to generally inspect the skin of the stomach. For the purpose of this video, we are not going to lift up Bella's shirt as requested by Mom and by Bella. So we're going to go ahead and inspect the skin generally on a patient. Notice any deformities, any peristalsis, any fluid shifting. Notice the umbilicus, notice any hernias, and make sure that everything is intact. I'm going to go ahead and auscultate with the bell of my stethoscope the arteries. So we're going to do the aortic, bilateral kidney arteries, the iliac, and the femoral. Good. And then we're going to go ahead and auscultate each quadrant, starting with the right lower, right upper, left upper, left lower. Here we're listening for any hypo or hyperactive bowel sounds. Next we're going to move on to percussion. So we're going to tap lightly over Bella's stomach, listening for any tympany, any dull sounds, anything like that. You're going to feel me tap lightly, okay, Bella? And here we note the liver on the side of the spleen. Good. Any pain when I do that? No? Next, we're going to go ahead and palpate the abdomen. We're going to keep on percussing, and I'm going to percuss the, I'm going to percuss for the sounds of the liver on the right side. So I'm going to move my hand a little bit and do that again. Okay, Bella? And we're going to note the dullness. Go ahead and turn to your side. We're going to note this as well. And about how far down the liver. Good. Okay, you can come back on your back. Now we're going to go ahead and palpate. So you're going to feel me lightly touch. Here we're going to feel for any pain, tenderness. If there's any abnormalities, we can note the skin as well here. Then we can go ahead and do a little bit of a deeper pressure. So here we feel for masses, any organs, any abnormalities in the stomach. So touch lighter, go in all the quadrants. Sorry, Bella's neck tip a little bit. Okay. Next, we're going to go ahead and after that, we are going to do a fluid wave shift, especially on pediatrics. So I'm going to go ahead and support the patient and tap out of the side. Make sure there's no fluid shifting through subcutaneous tissue on either side, and you can repeat it and do it on the other side as well. Here, we're going to go ahead and sit you up. We're going to do CBA tenderness. So I'm going to have my hand placed flat on her back, and we're going to tap lightly with the ulnar surface. Let me know if there's any pain. No? No? Okay, good. Here, we're going to defer the genitalia and the breast exam. So the breast exam, we rate pediatrics on a Tanner scale. Bella's currently at a 3, and we note this on the size and the contour of the breast at this time. The genitalia, we'd be monitoring the external genitalia, the clitoris, and the uvula at this time. For boys, we would notice any circumcision, the scrotal sac, any hydroceles, hernias, anything like that at this age. After that, we're going to go ahead and switch to the skin. So we're generally going to assess Bella's skin during the whole assessment, but now we can take a further look. We're going to go ahead and assess the skin. I'm going to look at your hands, Bella. We're going to note the color, temperature, moisture of the skin, the tone of her legs as well while we're doing this. We can feel for pulses or pedal, tibia, and her radial pulses, which are +2 bilaterally. After that, we're going to go ahead and move to the range of motion. For pediatrics, we would do a hip assessment, which is the ortolanis and the Barlows. So we'd be maneuvering their hips, moving them at a 90-degree angle for the ortolanis, putting their knees up and rotating their hips, making sure there's no clicking. Any discomfort for the baby, making sure there's no popping for the hips. For Bella, we're going to do a different range of motion since she's a little bit older. Bella, I'm going to have you go ahead and mimic the same movements that I do, okay? So we're going to go ahead and start with your head, go down. We're going to do flexion, extension, lateral, twisting, good. Next we're going to go ahead and do your fingers and your wrists. So flexion, extension, move your wrist around. We can do hands out, ulnar deviation, radial deviation. We can go ahead and make it up here. Flip your hands out. So we're testing the wrist, good. We're going to go ahead and flex your hands out. We can do abduction, adduction, and we can do thumb up position, so bring your thumbs up, good. Next we're going to do elbows, so go ahead and bring your elbows up. You can go out, which is hyperextension, good. And then we're going to test your shoulders, so you can do flexion, extension, hyperextension, then touch your hands to your shoulder, internal rotation, touch your hands to your back, external rotation, good. And an abduction, so hands out, adduction, good. And then make circles with your arms. Good. I'm going to test the strength as well. Can you squeeze my fingers for me? Squeeze, squeeze, good. I'm going to have you make your muscles pull towards you, push out. Good. Put your shoulders up. Good. Next, we're going to go ahead and start with the ankles, toes, and hips and knees. So we're going to go ahead and assess the ankles. Bella, I'm going to have you go ahead and flex your foot up for dorsiflexion, plantar flexion, and go ahead and rotate. Good. Can you do that with the other foot too? Dorsiflexion, plantar flexion, rotate. You're going to go ahead and bring your feet in, out, good. Okay, next I'm going to have you go ahead and lay down. We're going to finish the assessment. We're going to assess for any hip and knee. So I'm going to press lightly here. We are going to do knee and hip flexion, so flexion and extension for the knee. For the hip we can do abduction, abduction. Go ahead and rotate the leg out. We can do internal and external rotation for the hips. After that, we can go ahead and do meningeal signs. So we can do Kiernigs and Brzezinski. So Kiernigs, you're going to go ahead and you're going to I'm going to bring your knee up and let me know if there's any pain. No? Okay. That would indicate any meningeal abnormality. And then for Kiernigs, for Brzezinski sign, bring your head to your chest. Good. And here, the knees would flex up at this time. Bella, I'm going to have you go ahead and sit up again. We're done here. We are going to go ahead and do deep tendon reflexes. So I'm going to test all of the reflexes bilaterally. There. Good. The brachioradialis. The bicep. Tricep. The knee. Good. And then we're going to do Achilles. Good. Okay. After that, we're going to do light touch sensitivity real quick. Let me know if you can feel this. Does it all feel the same? Yeah. Yeah? Good. Okay. Next, Bella, I'm going to have you go ahead and stand up real quick. We're going to assess the gait, so I'm going to have you go ahead and walk back and forth with me. Notice any ataxia here, any limping, any pain while she's walking. We're going to finish your spine, so we're going to have you stand up. Go ahead and flex down. This is flexion of the spine. Notice any S curvature of the spine, any step-offs, any pain, tenderness, swelling here, and test for scoliosis. Go ahead and support your patient, bring them back, flex a little bit further, and a little bit further. Good. Next, we're going to go ahead and do rotation of your spine. Move a little bit. Good. Side to side. Any pain? No? Okay. After that, you can go ahead and have a seat. And then for here, we also assess neurologically, is she intact? Does she know where she's at, who she is, what grade she's in? And we can also assess with mom, too, if this is appropriate for the child at this age, and go from there. For babies, we would test the Moro, sucking, rooting, and any other advancements at that age. And for now, this concludes the assessment. Thank you for your time. Thank you, Bella, and thank you, Mom.